Autism spectrum disorder (ASD) is a condition related to the development of the brain. People with this condition usually have problems to communicating and interacting with other people. They also tend to have a restrictive and repetitive behavior. The term autism was originally coined by psychiatrist Eugen Bleuler in 1911 to describe what he perceived to be one of the most important symptoms of schizophrenia, social isolation. Then, Leo Kanner is considered as the father of autism. He wasn't the first to describe the symptoms, but he was the first to differentiate it from schizophrenia. Leo Kanner described autistic disorders as lack of contact with people, self-assertion, and emotional loneliness. There is no cure for these disorders, but an early and intensive treatment can make a big difference in the lives of many children.
The cause of autism is not known, though it is known to be a generic disorder. It is more common in siblings of children with autism. 4.5% frequency is siblings of patients. Autism could result from disruption of normal brain development early in fetal development caused by defects in genes that control brain growth and regulate the way neurons communicate with each other.
Some children show signs of autism spectrum disorder in early childhood, such as decreased eye contact, lack of response when called by their name, or indifference to caregivers. Other children may develop normally during their first months or years of life, but suddenly they become withdrawn or aggressive, or also they lose previously acquired language skills. In general, the signs can be observed during their first 2 years. Children with autism spectrum disorder tend to have different symptoms. So, some children with this condition have learning difficulties, but others show signs of subnormal intelligence.
Between the symptoms, we can also find that people with autism play with toys on the same way all the time. They tend to put toys of objects in a line, organize it in a very specific sequence that they know from the bottom to the top, and they can even tell you the sequence with their eyes closed. So it's normal that they get mad if somebody comes and break that sequence. Something that we can mention about it is that they get overstimulated very easy. So any change in the environment can make them uncomfortable, can be a noise or even a touch of somebody that they don't want to be touched. Something that is very interesting about autism is that they have an obsession with a specific topic. That topic can go from knowing all about dinosaurs to knowing all about pencils. What is sure is that they are going to tell you all the information that they know about that topic whenever they have the opportunity to do it. Also, they tend to get stuck words and phrases in their minds and they tend to repeat it all the time. Another symptom that we can mention about autism is that they run in circles, like flapping with their hands like little birds.
Other symptoms of the autism are delay in language skills, cognitive movement, and learning, hyperactive, impulsive, or inattention behavior, epilepsy or seizure disorders, unusual eating and sleep habits, gastrointestinal problems, for example, constipation, unusual moods or emotional reaction, anxiety, stress, or excessive worry, not being afraid, or having more than normal. To prevent the autism, you can drink folic acid before and during pregnancy to reduce the risk of the autism. Taking uh, folic acid and other dietary supplement with the presence of vitamins A, B, C, and D before and during pregnancy could reduce the risk of the autism in the baby, according to a recent study published in journal JAMA Psychiatry. To treat this condition, the fact that there is no cure for autism spectrum disorder and there is no one size fits all treatment. The goal of treatment is to maximize your children's ability to function by reducing autism spectrum disorder symptoms and supporting development and learning. Early intervention during the preschool year can help your children learn fundamental behavioral, communication, functional, and social skills. Those patients who have early access to multimodal treatment improve significantly. The environment must be highly structured and include special education teacher, speech and language therapy, vocational treatment, and adaptive skills training. Behavioral treatment reduces unwanted behaviors, promotes language and social interactions, and also increase a skill that foster independence. Um, it is essential for parents to help their children and find the necessary services available in this area. There are associations of parents of children with autism that are very helpful and organizing in distributing resources. Educational programs should be based on structured principles and include behavioral learning system, speech therapy, and occupational therapy. Psychotherapy is indicated in high function autism and in Asperger's disorder, all aimed at improving social skills or the expression of feelings. Sometimes the use of medication is necessary to treat psychiatric symptoms that may appear, such as antidepressants, to reduce repetitive behaviors, and antipsychotics to improve social interaction.
There are too many famous people with this condition, like scientists, tycoons, soccer players, but in this occasion, I want to mention that the well-known Bill Gates is a co-founder of Microsoft, is one of the richest men in the world. He has demonstrated extraordinary computer, marketing, programming, analytical, and business skills. He has a type of autism. As he himself has said, he has many characteristics of Asperger's syndrome, such as difficulties in interacting socially, his speech is very monotonous, and other characteristics.
A very structured schedule is the key to make sure that your student with autism feel comfortable and safe in your classroom. Students with this condition have difficulties with time changes and schedule changes. For them, routines are important because routines allows them to know what will be taking place during the day at what time. So with this, they can feel prepared in somehow, and this makes them feel in control of the situation. Something important that we have to mention is that if you're gonna change something in the schedule, you have to let them know first. Because if you don't, they are gonna lose the trust on you, and as a teacher, we don't want that. Since students with autism display sensibility to sensory stimulants, it's important to have a designated quiet area where they can go whenever they are feeling overstimulated by all the sounds around the classroom. If there is not space for a quiet area, we can play silent games with the other students. There are also some other items that can help your student to calm down from a sensory overload, like headphones or egg plugs. Do what works the best for your classroom and your student. Not all the students with autism will need the exact same accommodations. And this is why you as a professor need to know that your student. What are their interests? What makes them feel uncomfortable? So with this, you can do the accommodations that they really need. Also, you need to have into account that you are there not only to help them with their academic success, but also with their social emotional development.